Assalamu alaikum everyone, and welcome to the MCB COVID-19 report launch. We're so grateful for everybody joining us this evening for a fantastic lineup of guests, contributors, and important community stakeholders who really helped in the response to the pandemic. I'm quite delighted to say that from the MCB there has been a lot of collaboration and a lot of support from so many different organizations, umbrella bodies, healthcare professionals. And this evening is really about showcasing the best of what we have done and what we're continuing to do. So I thank you all for joining us this evening. Inshallah, in terms of the program, we're going to be having some panel discussions, sharing some reflections from the different bodies that have been involved. And also just a little bit of housekeeping. Just a reminder that you can ask or share any comments or questions in the Q&A facility. And also you will all be on mute as we have our guests ready to speak to you soon. This session is being recorded and live streamed. So you can catch up later if you're not able to stay for the entire thing. So I'm now going to ask Brother Lameen to begin in true style with some recitation from the Holy Quran, inshallah. Just over to you, Brother Lameen.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين يا أيها الذين آمنوا استعينوا بالصبر والصلاة إن الله مع الصابرين ولا تقولوا لمن يقتل في سبيل الله أموات بل أحياء ولكن لا تشعرون ولنبلونكم بشيء من الخوف والجوع ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون صدق الله العظيم.
Thank you so much, Brother Lameen, for a very beautiful recitation and very fitting. I would now like to ask our first panel of speakers to join us for this session. And also before we begin, just to share some apologies that we've had from two of our speakers unfortunately could not make it. Brother Fadi Atani, who from the Muslim Charities Forum, unfortunately is not very well, so we send him our du'as and prayers, and the same for Sister Samia, who's a essential worker, so we do send our prayers to them both. So I'm now going to introduce our first panel, Haroon Khan, Secretary General of the Muslim Council of Britain, and my boss, Dr. Sharif, President of the British Islamic Medical Association, MP Naz Shah, and Rizwana Hamid, Director of the Centre for Media Monitoring. So what we hope really to do is have a conversation with all of our speakers, I guess, regarding their kind of experiences in responding to the pandemic and also in bringing together the community as part of that response. So if I could ask you all, yep, you're all ready to go. So if I could go to you first, Haroon. Obviously, from the MCB side, there has been a lot of work that had to be done, particularly as this was crisis management and response. But what do you think was really key in the MCB being able to bring together so many different community stakeholders under such tremendous pressure to mitigate and response? What was really critical to that? Just, yeah, you're gonna have to.
Okay, it's working now. Thanks, Zara. Okay, assalamu alaikum wa rahmatullah to everyone who's viewing this session, inshallah, and thanks for joining us. Bismillah ar-Rahman ar-Rahim. I think the verse that comes to mind, Inna ma'al usri yusra, you know, verily with hardship comes ease. That's from the Quran, Surah 94, verse 5. And that's really been quite poignant throughout the whole period that we faced the COVID-19. It seems some months have gone by, but obviously not that much has changed. You know, huge challenges, and a lot of which are captured within the report from the work that's been done by the MCB, by our affiliate organizations, and also by Muslim communities up and down the country quite extensively. You know, the world has pretty much been brought to a standstill. And I think the word that always affects me every time I hear it, and I don't actually like it really, which is unprecedented. It almost feels like overused now in terms of the term. I think there's a big difference from us as Muslims and the way we responded and the way we respond generally to tribulation and trial. That our faith instills in us a way to respond to trials and tribulation, because throughout the Quran, Allah subhanahu wa ta'ala has constantly spoken about trials. The prophets were tested, generations of Muslims were tested, and numerous ahadith about trials and test. And really, when you put all of our test and trial in the face of that, what we know through history and also through Islamic history and the lives of the prophets, it's not as challenging, I would say, for some of us. I know many families have struggled, and they still are, and many people are struggling, but we find solace in the scripture, in the Quran, and through those examples of Prophet Muhammad ﷺ and other prophets who were tested throughout their life on how to respond to trials and tribulation. And I think that's how we need to view it. And alhamdulillah, I have to say, when we look at the report and what's in there and the way Muslim communities have responded, it's been quite exceptional. Obviously very proud in the sense that as a Muslim, you know, we can stand up and say that this is how we responded. When we look back in history, inshallah, that the resilience of our communities really shone through, not only for Muslim communities, but I think for British society as a whole. You know, the response, whether we talk about at community level, whether we talk about at mosque level, or when we look at the NHS, and I'm sure Dr. Sharif will mention some of this, but the NHS, the health workers, their response being at the very forefront of the response from the NHS and the way they responded, you know, putting their life before others, really. And again, witnessed again by the very early deaths of Muslim medics on the front line, rahimahumullah. You know, those Muslims who dedicated their life to medicine, to helping others, and they became the first shuhada in the face of this pandemic. So I hope and pray, inshallah, that, you know, we can learn a lot. We've done so much as communities. And one of the main objectives really from the Muslim Council of Britain from the very outset, I can't say that anyone was prepared. I mean, if the government themselves weren't prepared, how can anyone expect anyone else, us being the voluntary organization that we are? But even despite that, the way we responded, our community responded, was exceptional. So I'd really like to express my deepest gratitude to our friends, affiliates, partnering organizations for their selfless efforts in helping our communities tide through. And we're still in the middle of it. I mean, the second wave has hit us now, new restrictions, varying restrictions from different nations within the UK. But very much so, I think really appreciation to everyone. And I hope that from today's session and the report, it's something, I personally felt was really important as a record of what we achieved. It's only a small document really in the reality of what's happened, but I felt it was something that's really important and is captured for future generations to understand how we responded as Muslim communities to the pandemic. Thank you.
Thank you so much, Haroon. And I guess most people will probably not get to see the behind the scenes of what that actually looks like.
It's boring.
The organized chaos that we were in,
yeah.
And the many, many WhatsApp groups that were formed in the process. And I think quite a tremendous effort from the person writing those resources, to designing those graphics, to the countless webinars and, cross-team collaborations. I think what was really fantastic to see was the collective leadership that was really being shown by every organization. And every sector really coming and saying, okay, what can we do? How can we help? From funeral and bereavement all the way through to health and the charity sector as well, each of which had also received a bit of a hit on their own work. So really, thanks so much for those reflections. Inshallah, maybe we'll come back to Haroon. If you have any questions, please do share in the box. And I'd now like to go to Dr. Sharif. Don't worry, Dr. Sharif, you're not in trouble. But as the doctor and the president of the British Islamic Medical Association, I guess given this was a public health issue, and one we'd never really experienced before, how challenging was it for you to kind of, I guess, coordinate the public health messages that needed to get out to our community, given how, significantly they were affected, and kind of pulling it all together? So bringing the Muslim community closer to that public health message, as well as managing all the support that you probably needed to give to your own team who are at the front line. So maybe just sharing some of your reflections from, that experience.
Great. Assalamu alaikum. Jazakallah khair. It's great to have such chance for conversation really, and to share the experience. As Brother Haroon said, and as you just mentioned, it's definitely a new experience. It never happened before. We've been learning, and we're still learning. And we had a few challenges, obviously, over the last few months. From the BIMA point of view, I'm probably maybe going to touch on what we've done, probably maybe to start with, what we've done to our own medical members, our medics, to medical students, to junior doctors. And then we'll probably maybe touch on what we've done with the wider community, Muslim community, and even beyond the Muslim community. So the first few things we had to do is really get ourselves updated, and we had to start a few sessions for our junior doctors anyway, as like induction if they want to work on the front lines. We encouraged a few webinars, like updating webinars, even COVID question time regularly. And also, believe or not, we had quite a few research experts working on the academic research publications, and this is done straight before the Ramadan time, and we had a very good, great Ramadan rapid review, which probably maybe consists of 22, 23 different subspecialties, and managed to get this published by Royal Colleges, by the Medical Society, and adopted by Hospital Trust as well, and how Muslims need, whether actually Muslim medical staff or Muslim patients, need to be looked after during Ramadan and during the COVID time. So this is actually some of the activities we've done locally within BIMA, within our medical community. Now, moving to working with the MCP, we're really very proud to be almost like the medical arm of the Muslim National CRG. Great. We always find actually it's great to have like unity, and the MCP really helped significantly to bring everybody around the table. And I mean, many webinars. I can't even imagine how many, mashallah, many meetings. We've got a team, and great thanks to our BIMA Vice President, Dr. Wajid Akhtar, has been almost like on call 24/7, and working with a great staff as well, great team within MCP and others. I mean, looking at the medical risk assessment when we started. In fact, I should admit, we've started even before the government actually started the lockdown, the formal lockdown. So planning before the lockdown, planning before Ramadan starts, planning before Eid, planning before the restriction, and even relaxing restriction. It's great to have a good number of meetings. And not only this, we had a great encouraging our community as well on the regional arena as well. We had a few meetings even recently locally. We've been engaged in helping recruiting Muslim and the BAME community into the vaccine trials. So lots of challenges as well. We've been involved in the media. Many of our BIMA members being involved almost regularly on the weekly basis, the national media and the Muslim Islam channel as well, almost regularly. There's a program every week, and internationally as well. And we've been involved in a few high-profile events like Prince Trust webinars and things like this. We went, in fact, even beyond the working with the Muslim community. So we thought, as Brother Harun mentioned quite clearly, the highest number of deaths actually happened within the community, within our Muslim community, and within the medics, Muslim medics. I mean, one of the papers actually published in the summertime, almost 95% of the Muslims, 95% of the death within the medical staff from the BAME community, which is really, and mainly Muslims actually, so which really raised the alarm. So we had to lobby behind it, and we've been involved in many meetings and trying to get BAME medics organized. So we managed to get almost 40 medical organizations in Britain lobbying behind us anyway, and trying to work on the inequality within the NHS, as well as the report, which you probably maybe the inquiry and the report came after it from the NHS England. We worked with the BMA, we worked with the Department of Health, and this is really quite a busy time and a challenging time for us. Also, I should admit, for us as well, it's a business as usual. So we never stopped as a BIMA. You probably may be aware, maybe some of you are not aware. We had the organ donation. There's a law called the opt-out law, came on the 20th of May. So we had to get our community, our Muslim community, really aware of this and informed, quite well informed. So we had a few webinars on this. We had the induction as well for our junior doctors in general and pharmacists. Also, we have the Lifesavers. Lifesaver campaign is really a great campaign has been going on for a few years. And this year we had, in fact, the first time challenging to do it actually online. And not only this, we've been leading the Islamic medical associations in the world as well. We had it's a FEMA, Federation of Islamic Medical Associations. So BIMA been acting almost like on the leading seat on organizing this lifesavers in over 10 countries. Also recently, last week, we had the cancer screening campaigns been going on. And this is just part of what we've been doing, but the challenge is actually to do it in the virtual world, which added to what we've learned. I think that's probably maybe just give you some flavor of what we've had, and hopefully we can answer some more questions if needed. Jazakallah khair.
Thank you so much, Dr. Sharif. You forgot to mention also saving lives as part of your jobs on the front line, you know. So, I mean, I think from MCB's point of view, BIMA has been, you know, such an important partner in the work we've had to do. And I think there's been pressure. Oh, BIMA,
we had a great team, to be honest. I'm really just a member of the team. Well, we had a great, fantastic team. And Brother Salman Wakar, and Brother Wajid, and Brother Amir, we had a great team. And there's a few sisters, mashallah. I probably may forget to mention, we had 6 videos being produced by one of our sisters. She's a consultant in palliative care, end of life, fantastic. It was being copied into different languages as well. Again, the mental health actually was really quite important during the COVID time. And that's really helped quite a lot.
No, thank you so much, Dr. Sharif. We'll definitely be coming back to you, inshallah, for questions. But as you said, it's really the tip of the iceberg in terms of the amount of work that's probably being demanded of BIMA at this time, and obviously continues to be. I'd now like to bring in our Member of Parliament, Naz Shah. Thank you so much for joining us this evening and for taking time out. I'm sure you get a lot of questions coming to you regarding the pandemic daily. I guess from our point of view, you know, a lot of the community were very confused regarding the messaging coming from the government, and I guess the frequent change in messaging. You know, we definitely experienced that, you know, the kind of Eid lockdown in the north, which, you know, got a lot of people really upset. And I guess our question really is, you know, from your perspective, how do you feel, you know, the communities around you and that you've been working have responded? And also as a Member of Parliament, what have been the challenges yourself in making sure that representation is there? And I guess in the myriad of issues that you have to take care of, you know, taking care of communities during the pandemic as well.
Okay, Bismillahirrahmanirrahim. Assalamu alaikum. Absolute pleasure to be here. Thank you very much, Zara, for that introduction. Can I just say what an honour it is to go follow my usually service in Parliament, but genuinely on this meeting to follow Brother Haroon and Dr. Sharif because of the work that you've done. And I just want to say thank you to not just MCB, but all of the people who've been working, the medics, the people in the background, because I know how difficult it was during those first few weeks. And without guys, you know, it was jumping on Zoom calls at silly hours sometimes, trying to get this right. And we had Ramadan during that lockdown, the initial lockdown, the challenges that we had. And I couldn't have done it without the support of all of you. So thank you very much for that. Can I also congratulate you before I start talking about the amendment on the report? And I don't know who came up with the report title, Together in Tribulation. It really, really does sum it up, isn't it? That word of together, about not just for Muslims, but we were in this together. As Muslims, people from the communities, from the wider communities, we were together. And that really, really does hit home a real chord for me, because when we talk, I've been asked to talk about the COVID legislation. So we found ourselves in a situation which, and I appreciate it's the word unprecedented, Haroon bhai. You know, the truth is, we'd never seen anything like this in our lifetime. And, you know, people were equating it to the Second World War. People were equating it to lots of trials, you know, the Spanish flu in the 1920s, etc. The truth is, in our lifetime, we've had the crisis that we've had. Wars, we've had austerity, we've had long-term kind of things, but this was just something that the government was very ill prepared for. And it was ill prepared because we focused the last few years on Brexit. And this isn't just from me as a party political point that I'm the Labour Shadow Minister for Community Cohesion. That is a fact. You know, many have commented on how unprepared we were. The challenges for us from a position of leadership were, and Dr. Sharif will can testify to this, is that we had 10 years of cuts in the NHS, and all of a sudden we had a pandemic, and we had to ask a NHS which hadn't been funded correctly, stepping up. Now, alhamdulillah, the communities across the board came together and raised lots and lots of money for the NHS. But it has to be said that the NHS is not a charity. And it's amazing the work that we did. I've donated, people have donated in my constituency. The communities, even the minority communities within the minorities came together and donated, but that shouldn't have happened. Nonetheless, alhamdulillah, we are where we are. But in terms of what was specific for us as a Muslim community, in terms of legislative wise, we had a bill coming before, the COVID legislation, which we wanted to review every 6 months. And in that bill, it didn't give us the comfort and the security of ensuring that should there be a high number of deaths, would Muslims be guaranteed their rights for a funeral? And that applied to our Jewish brothers and sisters as well. So the work that happened in that 48 hours of campaigning and lobbying before the bill came to Parliament was about securing an amendment. And I'm alhamdulillah, I'm extremely blessed that Allah puts people in place at the right time, and people came together. I couldn't have done it on my own. It was yes, whilst my name was on it, and I took it to Parliament, and I secured it, and I did all the negotiations. It was because of lots of people in the background who are doing the work and helping me and lobbying. And MCB joined that, many of our organisations joined that. That to get an amendment in Parliament, and these were the difficulties that we had to think about. So politicians weren't in Parliament, so we didn't want it to go to an actual vote to get an amendment in. So I had to negotiate with our front bench and the government front bench to get something that would be amenable to them. And it was emergency legislation. It was like never ever done before. Time was of essence. And then to be able to secure it I put my amendment in on Saturday afternoon following the negotiations. Once the draft bill had come out, I think it was Thursday, Friday, and then by Saturday we put the amendment, submitted the amendment, and then it was about lobbying MPs to support it. We had over 120 MPs that I know of that actually put their name towards the amendment. It was the most lobbied amendment in those 2 days, from what I understand. The campaigns were brilliant. So again, thank you to MCB and the people who supported it. And it didn't go far enough in terms of the wording wasn't strong enough, because if we'd have put stronger wording to begin with, we had to be mindful that the government could have just said, no, we're not going to accept it. So we wanted the government to do the climb down, because it didn't matter who did it. It was the point was we needed to get to a position where there was no worry in the Muslim community or the Jewish community that in the circumstance where we have so many deaths that we would be cremating a Muslim or a Jew. So by Sunday afternoon, the ministers we will add guidance. And that's where we were by Sunday afternoon. By Sunday night, Monday morning, that had turned into, yes, we will accept an amendment, and we will put in an amendment, and we'll put in some words. So we were very, very successful with that. And for the community, that was huge, because, as a Muslim, it's we live for our we live to go, we don't live to stay, kind of thing. So for us, it was very, very important. And it was the first time, with my understanding, that the Muslim community and the Jewish community have come together on something which impacts on legislation, and it actually went through Parliament. That is my understanding to this day, unless somebody else can tell me otherwise. So I'm grateful to the Jewish community who came on board. I'm very grateful for all the work that we did. So once we'd got past that legislation, it was like Dr. Sharif said, it's back to work as normal. In my constituency, we have this, and I don't doubt it was up and down the country. All of a sudden, you have the issue of people, losing their jobs, the financial impact on families. People were getting made redundant. The furlough scheme wasn't announced till a week later. So there was real panic. There was real worry. We had the whole panic buying issue up and down the country. That was challenging, and trying to give assurances to the constituents that we're working, and we're trying to get ahead of this, and not knowing what was going to happen. That uncertainty was, the biggest enemy of business is uncertainty. that impacts on the economy, and it's like you know the rest because you've seen it and witnessed it for the last 7 or 8 months now. And we then had the issue which Dr. Sharif and I and Haroon and I talked about a lot, which was end of life visiting. So we had people going into, and it was relentless because we had so many deaths. We know that people were impacted on highly in Black and minority ethnic communities. The messaging, we had to do our own. I remember writing to Matt Hancock on the 19th of April, asking him what he'd done, what equality impact assessments had been done to communicate with communities about Black and minority ethnic communities. We knew the disease was impacting on those communities disproportionately. However, that wasn't, I didn't get an acknowledgement for that letter, I didn't get a reply. A couple of weeks ago, the Minister, Kemi Badenoch, came to Parliament with a part report of her investigation into COVID and the disproportionate effects on Black and minority ethnic communities. And again, they said they'd put in, I think it was 4 million or something into communications. But I know, and as the Muslim of Pakistani heritage, I know that when I spoke to the commissioners for the Pakistani news channels and the local radio stations, there was one advert, one campaign that went out on Sunrise Radio, which was for 7 days back in May. Nothing else since. We didn't get any campaigns out from the government into Black and minority ethnic communities, into news stations that my mum would watch, your mums and dads would watch, into that language. And I know that the Jung News Group had to approach Downing Street to get a commission. So the failures are very, very stark. And it's like we've talked about this evening. The truth of it is that we will get to a position where we will look back at this and history will be the judge of what's happened. What I am proud of, and I am exceptionally proud of, is how our community stepped up. People stepped in to make those videos like Dr. Sharif talked about. People stepped up and made posters. People stepped up and did messaging in their own languages to get out. Medics came together. In Bradford, we had Dr. Sharif, we had the Markaz medics, again, from mosques coming together, putting together videos and getting them out. That did go a long way. And in terms of and I've noted that the report does talk about whether we were prepared as a community for burials. I can say that, alhamdulillah, in Bradford, we do have the Council of Mosques. We do have some Muslim funeral services, Shirazi funeral services, and a few others, Madni, who were really, really good. But we all supported each other locally and nationally in all these efforts. I'm proud of the way the community stepped up. And we also faced, this was against a backdrop of people like, and that happened across the communities. And I noticed somebody said it was Birmingham as well. Absolutely. But I'm going to speak from Bradford for where I experienced it firsthand. And I have seen it up and down the country. And I'm really proud of the national efforts that went in. And this was against a backdrop of the increase and rise in Islamophobia, where I know when we talk about Birmingham, we had pictures being used from a Birmingham mosque suggesting that Muslims were spreading COVID, Muslims were responsible, the likes of Britain First, and the propaganda that was going on in the background was was ramped up at a time of crisis. And yet we continue to do what we do, which is, and that is, alhamdulillah, as Muslims, that is part of who we are. We carry on. We carry on doing what we need to do. But there is a time for reflection, and now we're in a second wave. I am worried. I am genuinely worried because we have got, in Bradford, I've only just recorded some more messaging this weekend because we are seeing it is impacting on particularly men, Muslim men. We are being disproportionately impacted on, but we cannot forget that all of this is years and years of the systemic racism. I mean, Kemi Badenoch does not recognise, and the task group that she set up does not recognise institutional racism. But we have to look at the Lawrence review, the Doreen Lawrence's review. We have to look at your report, the report that we're here to talk about today, and take from that so we can make sure we're influencing services. And please, all of you, take that report. I've seen it on MCB's Facebook, and send it to your MP. Send it to your MP, send it to your council, and ask them to look at this report and the findings, because there's lots to be learned from. Happy to take questions. And Jazakallah, thank you.
Thank you so much, Naz. What an incredible and comprehensive breakdown analysis. I'm sure they'll be coming back to you for more commentary on what we should and shouldn't have done. And I think also a testament to your own work in pushing ahead and making sure actually where the response was needed, especially on burials, which was a really, I think we nearly had over 1,000 people on that webinar that we had. It was one of the very early ones, and the kind of fake news that was going around. So thanks so much. We're going to go to our next speaker, and then we'll take some questions, because I can see that there are a few for you. If I can now bring in Rizwana Hamid, our director for the Centre for Media Monitoring. Thank you so much, Rizwana. I'm sure it's been a long day for you. I guess, you know, as actually Naz quite rightly said, the media portrayal was very interesting even during a pandemic, and we were still faced with the situation in which, you know, we had these images of Muslims breaking the rules. And I think, you know, from the MCB, so the Centre for Media Monitoring point of view, it was quite critical that we responded and corrected those images. So how was that experience like for the Centre for Media Monitoring, and how important was it to make sure we had the story set straight?
Yeah, I mean, as you know, our kind of bread and butter is monitoring the media daily just to see how they report on Muslims and Islam. And initially, and quite, what would I say, not innocently, but naively, we thought when the pandemic started that, oh gosh, you know, there's going to be less coverage on Muslims and we can have a slight respite in terms of the amount of monitoring that we're doing. But very, very quickly, it came to light that although there was some very commendable kind of reporting that featured Muslim people doing great work, you know, whether that was in the NHS or whether that was within the community, it didn't really reflect the huge contribution that Muslims were making on various levels. And very quickly, there was a problematic trend that began to pick pace, which was attributing blame for the spreading of the virus onto minorities, and particularly those of East Asian appearance and Muslims. And it kind of further perpetuated. I mean, we've done reports, and there's been other studies that have been done by Cambridge University, Leicester University, which shows that the media's reporting on Muslims and Islam is contributing to, you know, the growing hostility towards Muslim communities. And we found that during the pandemic coverage, the media started perpetuating the negative portrayals of Muslims generally, and feeding into the kind of far-right trend of blaming Muslims, not only for spreading the pandemic, but for willfully breaking down lockdown rules, which in turn obviously fueled, you know, false narratives on social media and led to scapegoating, and then, you know, a rise in kind of consequences of hate crime, prejudice and discrimination. But it was interesting from the beginning. In March, I don't know if people remember, there was Tabligh Jamaat gatherings that were taking place in Malaysia, India and Pakistan at the time. And that was the kind of springboard from which the British media kind of took their cue, because the reporting in India specifically was very anti-Muslim. And the British media kind of took their cue from there, and the whole story of these super spreader gatherings started kind of getting quite a lot of profile, even though they were foreign news stories. And even though the kind of actual numbers of cases related to these gatherings was small, what we found that the media very much highlighted the fact that, you know, they were Muslims. We had images of people with, you know, salwar kameezes and with kufiya hats, topis, very specific imagery to show these are Muslims. And we contrasted that with, let's say, gatherings in South Korea that were kind of happening at a similar time within a church, where there were far more cases of coronavirus that stemmed from them. There was no mention of the fact that this was a church gathering or that the attendees were Christian. So a very kind of different way of approaching the coverage, depending on you know, the religion or the nationality of the people. Then we had a kind of a spate of a lull, and there was a few positive stories that came out with the community initiatives that were going on, you know, a bit of focus on some of the NHS workers. And then that went again very quickly, and we got on to really problematic imagery within the media. So very early on, there were cases of, for example, there was a story that was talking about prison visits in California being stopped as a result of coronavirus. And yet we had an image of a Turkish mosque, you know, nothing absolutely to do with that story. So real discrepancies there. Or we had images of Muslim men in hazmat suits praying outside a mosque, and yet the story was to do with Europe shutting down schools and, you know, markets tumbling and sports crisis. So again, nothing to do with Muslims or Islam. We had another famous one where, you know, when President Trump pulled out of funding the World Health Organization, instead of having a picture of Trump there, which would have been the most obvious thing, we had images of women in niqabs and in PPE. I mean, the list is endless, you know, and they're kind of, some of them are just really, there was one in the Times, for example, where the story was about partygoers, partygoers spreading the virus. And right on the front, you had two women in hijabs, you know, nothing to do with the nightlife or the nightclubs that they were speaking about or the parties that they were speaking about. So the imagery has been a really problematic area. And one kind of positive of COVID and the work that we do is we're always trying to get the community to get involved in our work, both in terms of monitoring the media, both in their local areas and nationally, but also submitting complaints. And I don't know whether it was because people were at home and working from home or not having to travel to attend, you know, some of our webinars, but we've found that we've created a really good, solid and growing volunteer base of people around the country who have been submitting images that they've come across or problematic articles. And we've been able to submit these and get quite a lot of changes. So we've had a lot of changes in terms of images that have been pulled down as a result of our complaints, headlines that have been changed, and headlines were another kind of problematic area. There was, you know, sensationalist headlines, and it started with the mass graves story. I don't know if you all remember that, where Eternal Gardens, which is a cemetery just outside of London, and there were images there and, you know, headlines of mass graves, which kind of conjures up images of, you know, genocide. It's quite an emotive word. So CFMM very quickly complained to the Mirror, who'd kind of carried that, to the Mail Online and to the Sun as well. Some of them changed their headlines very quickly. And this was because we also had statement from, you know, the director of the gardens, who clearly stated that these are not mass graves. They're just simply preemptive techniques to, you know, prepare the ground for several burials. And also mass graves normally imply that all the bodies are put together, that, you know, the bodies are unidentifiable, and that, you know, they don't have individual burial ceremonies, all of which was happening at this, you know, this graveyard. So again, really kind of misleading, inaccurate headlines, which again, we managed to get changed. And then there was, leading up to Ramadan, again, that became another spike of very sensationalist stories of how, you know, there was going to be a spike in coronavirus because of Ramadan, and people were going to go to mosques, even though the mosques we know had closed down well before the government had even, you know, announced the kind of regulations for closures. Again, we managed to get some stories changed along here. The Times had quoted I think he was a surgeon, sorry, but he was a medical official at a hospital in Birmingham. And being a journalist, my background is in journalism, I can just imagine the kind of question the journalist would have put to this doctor. And the response would have been, it was a leading question. So the doctor said that, you know, yes, there could be a spike in coronavirus cases if people gathered for Ramadan, you know, for iftar or something like that. But there were no ifs in these, you know, there were clear kind of headlines stating experts fear a spike in UK coronavirus cases during Ramadan. Again, we managed to get those headlines changed. Some of the papers actually took down those stories. The Birmingham Mail, which had carried it, which is where the doctor was from. Then we had the very famous Telegraph headline, you know, the exclusive of half of UK imported COVID-19 infections are from Pakistan, and the Sun and Mail Online followed suit and carried those headlines. Now, this was probably one of the worst stories because it was actually a non-story. When you dug deep, we kind of really did go into this quite deeply. We found that even though they were claiming as if, you know, all of imported cases came from Pakistan, in actual fact, they were referring to a 3-week period during June. That was the first point. And the second point was that there were only 30 cases that came from Pakistan, and that's out of 310 cases in Britain at the time. So that was less than 0.01%, a tiny, tiny figure, which really didn't even merit it being a story. But, you know, the Telegraph carried it as an exclusive. And even though they changed their headline to incorporate the fact that it was in June and it was only 30, we still took that complaint to Ipso because, you know, it was inaccurate to carry that story in the first place. And that complaint is still ongoing. You know, even in the political sphere, there was lots of, sorry, I've probably gone over my time, so I'll stop
there. To be
there.
honest, I mean, it's really interesting, but yeah, I have to host, so I can't pay too much attention. Yes. You know, awful, really. And to be honest, I think everybody could relate to what you're saying because we remember seeing it. I forgot about the Pakistan. Yeah, that was a really quite a highlight. And while you're still here, there is a question that's just come through. Maybe I'll get you to answer that, and then I'll come back to some of the other questions with the other guests. But you know, in terms of that positive narrative, you know, is there more we can be doing? What can we be doing to, I guess, counter things?
Yeah, I mean, that's kind of one of our aims as well within Centre for Media Monitoring, which is to kind of, you know, pressure the government, not the government, sorry, Naz, looking at you and thinking of the government here, pressurizing the media to actually present Muslims in a nuanced way and not fall into the trap of constantly portraying them in a negative light. But one of the things that we say is that we kind of train people up in how to write, you know, press releases, how to kind of form relationships with local journalists, national journalists, get the message out in terms of what we are doing and what we have been doing during this, not only just during the pandemic, but generally as well. So I think it's about people being confident enough to be proactive with the media. Because, you know, they'll always say that we're looking for good stories, and if you contact us, you will. So it's about testing them, you know, and if you're doing something, write a press release, find the right angle, you know, find the right platform, and then push and try and get those stories out there.
Thank you, Rizwana. And if you could kindly share maybe some of the resources from the Centre for Media Monitoring. I know they're doing workshops, which are also quite available. And yeah, I mean, honestly, excellent, really excellent kind of overview of what's been going on. And thank you from all of us for the nitty-gritty work that you guys have to do and making sure you hold the media to account and you get things corrected, because at the end of the day, it impacts people. And that kind of brings me on to the next question. If I could go to you, Dr. Sharif. You know, winter is coming. Well, I think winter is here in Scotland anyway. The nights are darker and things are getting colder, and it's flu season. In terms of well-being and mental health, you know, what kind of advice would you give to people, I guess, in the second wave of keeping healthy and also managing their well-being at this time as well? I think there we go.
Here we go. I'm sorry. Assalamu alaikum again. I think I don't want to talk from mental health point of view because I'm a plastic surgeon. So I probably maybe not the best to be qualified to talk, but we produce quite good talks and webinars on mental health, and we had a few psychiatrists being involved as well. Mashallah, I mean, our dean is full of beautiful advices, beautiful thoughts on supporting our mental well-being. And obviously, not only because the winter time is coming. I mean, we are in the middle of the second wave. We need to be really very careful. I mean, from generally speaking, we need to get our community, inshallah, to be convinced to be patient, to avoid being hospital patient. So we need to have the sabr. We need to really have the patience. I mean, we are almost touching probably maybe 50,000 deaths, I believe. Today, over probably maybe 580 deaths in Italy. This is really alarming. This is really almost remind us when we're in April, May time. So the idea is now is to get our community, inshallah, to be as good as we did. I mean, I second what Sister Naz was saying. I'm really very proud of what the Muslim community been doing over the last few months, even after the mosque opened. I saw it from very first-hand experience. They're really the best to stick to the guidelines, the best to give a great compliance as well. I know some mosques that in fact even offer little plastic sheet for praying mate, even offer mask if the people don't bring their own mask. So I think the Muslim community need to be congratulated really for such a great, but obviously, like all sectors, all the communities, just they had enough. I do appreciate people obviously fed up. The people had, but we really need to be patient. We really need to be patient. And this is a beautiful ayat the Sheikh started actually. This is all ibtila, this is all test from Allah subhanahu wa ta'ala. So we need to stick to this.
Thank you, Dr. Shah. Thank you so much. If I could bring in Haroon and then just finally with Naz, and then we'll move on to the next panel. Just some questions around, I guess, working nationally and making sure that all the different regions are included in this approach, and also maybe just a very quick message on, you know, the second wave and kind of what's to come from our side. Sorry, Haroon, I think you're, that's you.
Sorry, could you just repeat that again, Zara, please?
Yeah, so how have MCB made sure that everybody, again, across the nations have been included?
Yeah. Okay, so it's interesting question. So we haven't, maybe it didn't come through the presentation. There's actually quite detailed explanation of the workings of MCB and what's been mentioned a couple of times, the National COVID Response Group, CRG. And towards the back end of the report, there's a list of all the organizations, Muslim-led organizations that we worked with across the country. But in response to the specific question, we actually have member organizations, the Muslim Council of Wales and the Muslim Council of Scotland, who we've worked very closely with, along with BIMA, along with National Burial Council, Muslim Charities Forum, and the Mental Health, Muslim Youth, Muslim Youth Helpline. So big organizations that we've been working with throughout the whole period in developing a lot of this work, and especially very conscious of the relationship in terms of understanding the differences between each of the nation states as part of the UK, with bespoke messaging for those communities as well. So it was definitely handled, I would say, quite well by those organizations and in collaboration with us.
Thank you so much, Haroon. And just with a minute or two to spare, if I can come back to you, Naz, just regarding what is your message for, you know, for all communities, I guess, as we kind of approach the second wave, or we are in the second wave, I should say.
Thank you. It's weird when you're not in control of your mute button and unmute. So, Jazakallah khair for Rizwana. That was really, really, thank you very much for all the work that you're doing on the Media Centre, Monitoring Centre. My message really is simply this. Somebody said Shanaz Awan has talked about getting the vaccine and getting it prioritised. We've yet to know what government, I'd like to think that the government will take approach where they're prioritising those who are most vulnerable, and that is what we will be pushing for. Absolutely right, and it's right that we need to put more media stories out. But here and now, right now, our challenge is to protect and keep our community safe, and it's our challenge. The challenge right now is making sure that we don't have the pressures, increased pressures in some areas, particularly like in places like Bradford, where we have a higher population of Black and minority ethnic communities, minority communities who are impacted by this disease. So my message is really simple. Just please stick to the government guidelines. Yes, somebody's put in the chat that, Dominic Cummings, and I've said this in Parliament, the fabric of leadership and that contract between who was governing and those being governed was severely damaged with the Dominic Cummings affair. But that does not excuse us. We have a responsibility. We have a responsibility to look after ourselves and look after those that are our loved ones. And our elderly in particular are very, very vulnerable. So for not just for our own sake, but for the sake of keeping, those elderly around for longer and healthier, please follow the guidance and make sure others are doing the same.
Thank you so much, Naz. A very fitting end. Thank you all for your time and for your contributions. I know we didn't get to ask every question, but I hope we covered them all as well as we could. I do see some more questions in the chat, but we do have another panel, so we'll come back to you. So I guess you're all off the hook. Feel free to take a cup of tea and not enjoy being off camera. And if I could ask our next panel now to join us, Dr. Justin Varney, the Director of Public Health for Birmingham City Council, Dr. Tanweer Ahmed, Chairman of Lincoln Central Mosque, and Abu Bakr Adam, who has kindly filled in for Brother Fadi, the National Liaison Lead from the Muslim Charities Forum. Thank you all for joining us this evening. I'd like to perhaps start with yourself, Dr. Justin. You were quite heavily involved in particularly Birmingham. I don't want to say it was quite a hot spot, but obviously quite a busy place with a lot of COVID activity. But you were doing some tremendous work in communicating with the Muslim community in particular, and getting the public health message out, and also, I guess, coordinating that response. Is there some reflections you could possibly share with us on maybe some of the best practice that you saw, as well as some of the critical challenges?
Sure. So, I mean, first of all, I should say very much a team effort from England's second city. I could not have engaged with our Muslim communities without the strong support of the masjids across the city and of our faith leaders, both the imams and the secretariat and the chairman of the mosques. We started working together back in February, and actually I remember very clearly, I think it was about 2 days before we went into lockdown, I met with many of the leaders of our mosques in the city to talk about what I thought was going to happen and some of the issues and challenges. And ever since then, we've been meeting pretty much on a weekly basis. Once a week, we meet as an interfaith group with other faith leaders. And then on the other week, I meet faith groups separately. So I meet the Muslim group together and then the churches separately from the Hindu and Sikh communities. And that has been really important because although there are commonalities between different faiths, there are also important differences. And so having a safe space for them to be able to ask me and for me to ask them, and I have to say they've hugely increased my understanding of Islam over the last 6 months of working together, particularly some of the detail around things like funerals and burials. And that's been really important because it's meant I can lobby on their behalf in some of the negotiations on restrictions, but also I get a real sense of what the issues and the challenges in communities are.
Brilliant. No, thank you so much. I guess, I think particularly around the times of Eid and Ramadan were really challenging, I think, across all communities. I can imagine, given Birmingham's tremendous Muslim population, that would have been quite a few complaints at your door. What was that experience like, and you know, how did you guys manage? Oh.
There we go. I have to wait for permission to be unmuted by you. Well, firstly, I would say I don't remember a huge amount of complaint, actually, and I think it was a reflection of the partnership with our faith leaders in the city, and it's actually working with both our Sunni and Shia mosques, and actually bringing people together to share good practice and learning. So as we approached celebrations, we did so together. We stood shoulder to shoulder. There were joint letters, there were shared WhatsApp videos and messages, and that was really key. And it's something that you know, I'm really pleased to see in the report being brought out, actually how important that partnership across the public sector and the faith sector is in the response to COVID. And I hope it is a legacy that lasts for decades to come. You know, we have brought people that were talking to each other before, but never at this scale and never with the council in this way. And I've been very blessed and honoured to be welcomed into that group of faith leaders as a peer, and us working together in a truly, you know, balanced partnership. This has not been something where I've told them what to do. More often they're telling me what I need to know to understand the situation, and to also keep us grounded in the reality of people's lives, because it's too easy to write policy from a kind of ivory tower. Actually being reminded every day, this is real people, that their faith is important, that the details of the observance of faith is important, and working together to find practical solutions which protect people and save lives together has been at the heart of what we tried to do.
No, thank you so much, Dr. Justin Varney. You've got loads of supporters in the chat, so I think Brother Idris has given you a very big thank you, and there's some others as well, and from MCB as well, a huge thank you. We'll come back to you with some questions, so be ready for those. We will unmute you, I promise. I'd like to go to Dr. Tanweer now. As someone heavily involved in the masjids, I guess it's been a very busy season. I guess now we're facing the second lockdown, and we know the guidance for places of worship changed again. What has been the learning from the first lockdown and closing to reopening, and now I guess closing again from your side? And I guess for you, what has been really important from the masjid's perspective in managing those challenges? Because I can imagine so much pressure was felt from the surrounding community, as well as so much direction and leadership, I guess, had to be shown. And people often forget the mosque is just not prayer. You know, they are dealing with funeral and bereavement, marriages, they're dealing with welfare and support, the refugee community, the destitute, the vulnerable. I think everything under the sun, which we quite like to ask you to do and fix. So what was your experience like, Dr. Tanweer?
Bismillahirrahmanirrahim. Assalamu alaikum to all. First of all, I'd just like to thank you all of MCB team, Brother Harun and everyone else for wonderful work you have been doing. And particularly, I think the timing of report is very important. And I will encourage all those present that it should be shared with the council, MPs and others, because it's important so that the people can understand Muslims, but also the challenges Muslims face as well. So congratulations on producing this timely report. I think it is very important and it highlights the work Muslims have been doing. So in terms of, I think I'm quite proud the Lincoln has only one masjid, and we have very diverse community. So Alhamdulillah, I'm pleased the way the committee, the trustees have worked together very hard to keep them together. And the important thing, I think, certainly this is in first time in my lifetime, the masjids were closed. And it was very challenging for us to prepare our community and to make sure we can close masjid, because it was felt very challenging. And but the important thing, I think I'm grateful to my colleagues, committee member and trustees and volunteers who played very, very important role in communicating with community members, preparing them in time. And our Imam, we release a video clip of his preparing them and giving message that is important, that the lives are important and they need to understand that it is not in our control, is from Allah, and may Allah lift this deadly virus from us. And we need to follow guidelines, which is very important. So we collectively, I think communication was very important to, as I said, we very diverse community, and it was important that we prepare our community before first lockdown, and then obviously a lot of learning and second lockdown. When we opened masjid in July after first lockdown, I think we set up subcommittee to help us to prepare, help us to communicate with a wider community. And during even lockdown, I think we did a number of things to engage with community, because it was quite important, particularly in Ramadan. We have a daily lectures on Islam, and then on Eid day, we have drive-through children gifts. So people can come, and even they can't come out of car, but they can collect gift for their children, and also they can see the masjid as well. So it was that I heard from a lot of parents and children, they change they wear new clothes because they are going to masjid, even they're just collecting gifts. So I think we try our best to engage with our community widely, and alhamdulillah, and it worked very well. When we opened masjid, I think we were well prepared for burial arrangement. Our Imam played very, very important role. We order all PPE so that in case, alhamdulillah, there was no death in first lockdown, but alhamdulillah, we were well prepared for each and every aspects of the preparation for burial arrangement. Even I discussed with the council, because there was discussion that in case of shortage of graves, so we prepared that, alhamdulillah, we'll offer Muslim graves in Incan, so that we had a plenty of graves. So we were quite prepared in that respect as well, alhamdulillah. So I think we prepared everything. When we opened masjid, we provided mask. We asked all brothers to follow guideline. And one thing, really very proud of it. And to be honest, I hardly seen anybody without mask or not bringing their own mat, praying mat. So I must say, I think we were 100% in compliance. You will find occasionally once or twice that people forgotten their mask, and what we did, we were provided a mask in the masjid. They're always available so that they can wear mask if they forget, and which work very well in our case, particularly. Hand sanitizers were always available, and the lectures donation help us as well. I think we continue to encourage, while we were delivering lectures, we were encouraging politely for donation as well. Our madrasa, alhamdulillah, gone online, and so a lot of learning as well in terms of use of technology. People like myself to make sure I can use technology, but our Imam, alhamdulillah, and other teachers were well prepared, and they started online classes, which work very well. So is engagement as well, because mosque role is not just come and pray, but it's social, and particularly with our elderly population, to ensure we can keep in touch. And again, our volunteers help them quite. We also, I think, during first lockdown, and is still ongoing, Alhamdulillah, with our colleagues, we started food bank as well, so that which was available for all Muslim and non-Muslims, and which was quite used and still in use. Alhamdulillah, we started in first lockdown, and then we're still ongoing, and we hope and pray that we can continue, inshallah, as well. So I think there were a number of things we did, and for the second lockdown, I think I must say we were well prepared and community understood, and which helped us without any problem to close down. So I think I was quite worried first time that when we going to ask people to pray 1.5 meter apart, how the people will react, because with very diverse community. Alhamdulillah, I think we did not have any problem at all.
Thank you so much, Dr. Tanweer. I think a really nice overview and a good reflection of the many challenges. Some have said that mosques currently are the safest places during this pandemic. You know, credit also to the health and safety brothers that were helping out with MCB, who did so many risk assessment document templates, registration forms, track and trace. You know, there was so much practical advice given. There's so many different kinds of spaces. And I think another thing that came out was the online, you know, live streaming of prayers, live streaming of lectures, online Islamic classes. Fantastic. You know, kids online. I think they all thought, oh, well, a lot comfier from my home than having to come in. So I think thank you so much for all your work and contribution. And inshallah, we'll come back to you for the Q&A. I just want to go to our final guest of the evening, Brother Abu Bakr from the Muslim Charities Forum. Thank you so much for joining us this evening. We know that MCF and actually the charity sector was under a huge amount of pressure, particularly with supporting charitable causes at home. And I think MCF did a fantastic job of, you know, supporting local initiatives and encouraging other charities to do so. But right now we can, I guess we're seeing even the deeper consequences of the pandemic on the economics, you know, the economic impact on our communities. I guess maybe just some reflections from yourself at the journey from the start to, I guess, what you feel needs to be done next, and what kind of MCS is hoping to achieve to support communities at this time.
Sure. Assalamu alaikum wa rahmatullahi wa barakatuh. A very good evening to the panelists and to the attendees. And Jazakumullah khair for this opportunity. Let me begin by congratulating every single volunteer from MCB, from MCF, and across the Muslim community by actually becoming or being in the forefront of deliverable in terms of goods, support, and everything else. For those who don't know about the MCF, we're a network of British Muslim charities working for social good in the UK and abroad. And we aim to collectively build an accountable, transparent, efficient British Muslim charity sector. And we hope to do that with individual organization in the sector, and hopefully to contribute to a just and sustainable world. And I guess our starting point when MCF were first initiated back in March and kind of started to work with the community is actually the hadith from Prophet Muhammad sallallahu alaihi wasallam when he said, "Let whosoever believes in Allah and the last day honor his neighbors." So at the back of that, we've managed to kind of look at the Muslim charities responding to COVID, and we produced a report called The Neighbors Next Door, which is kindly featured on the MCB report. And from that, actually, we started to see a pattern of grassroots Muslim organizations, organized international charities, NGOs, mosques, cultural and faith-sensitive organizations, voluntary groups, umbrella organizations, and this kind of mixture all working together within an environment, within a COVID environment, within a UK environment, was actually very welcoming. And out of that, we've managed to capture approximately 300 organizations. That's 300 across the UK, and yes, as far as Scotland. And from that, we've kind of mapped out their response to COVID crisis actually varied. It was very quick, organized response, and also in a very organized manner. And the majority of the Muslim charities were actually looking at distribution of food, essential food items for the vulnerable, supporting some of the NHS staff, and exactly what's been featured in the MCB report, which is actually very welcoming. The bereavement, and then there was a digital divide in distributing PPE. So the work was actually conducted by the Muslim charity generally across the UK was actually fantastic. And this is because of the willingness and actually in the implementation of the hadith itself to actually honor the neighbor, whatever they are, irrespective of their faith, their race, their migrant status, their health, and even their wealth. So it was a response for that particular hadith that we actually saw in action. And alhamdulillah, and I think this is the spirit and this is the gift of the faith community to offer to the wider community. And MCB has captured this very nicely within the reporting format, and different people responded to different actions. What we actually found out from the report, which is actually very encouraging, which is the work level, but also we've noticed something that only 16%, 1/6, from within these the 300 organizations have actually access to what we call mainstream funding. So I'll give you an example where food was being distributed, given, and so on. We also had in parallel mainstream funding available for the organizations to actually carry out the food. So this actually started us to engage with mainstream funders, to engage with a wider national emergency response. And we are now a partner as Muslim charities, representing the Muslim charities who are actually delivering the work on the ground to provide an access to funding, food, PPE, and what's available within the UK domain and also within the government domain. So what we are, some of the examples that I've mentioned, we need to have less over-reliance on Muslim community resources and a greater collaboration, and also ensuring that the Muslim community responders connect to mainstream funders. And this is very, very essential moving forward. I guess answering your question, really kind of looking ahead from the economic impact, we've looked at the financial vulnerabilities of small to medium-sized organizations, and this has been all the 300 responders. So access to funding is now a must and it's paramount, and this is what it keeps organizations going, to support them as much as we can. And there's an economic group with the MCB that are trying to look at all some of these solutions, which is fantastic, and trying to also offer these organizations. But again, connection to mainstream funding, it's a must and it is required. There's also the greater collaboration element, where if 300 organizations can come together and produce this fantastic effort, and MCB exactly doing the same with mobilizing the masajids and ensuring they're safe, then there's more to be done. But also it needs to be done at kind of adaptation of a medium and long-term strategy, as opposed to just looking at second wave, third wave, because we still have a road to recovery, and no one is talking about recovery at the moment. And also being mindful, I think the last point, which is the volunteer fatigue, because we've relied so much on our volunteers to actually carry out the work and so on. But at the same time, we also have to look at their mental health well-being. We also need to look at how we support them financially, how we also ensure that they develop from their personal goals, because these volunteers are the actual heart and the engine of all the work is being produced, whether MCB, MCF, and they need to be looked after in a way that they also have a future. And I guess I don't want to kind of go on about some of the work that's been going on, but I urgently urge everyone to share the reporting, the MCB report, with every single member. It's not just MPs, just share it with your local neighbors, because if they see the goodwill and the value added from the community to the community, that will change its perception. And finally, I'll end on the hadith that Rasulullah mentioned, even if the end of time is upon you and you have a seedling in your hand, plant it. And I guess this is the energy, this is the positivity that we need to continue doing the work, do it strategically, with more collaboration and a positive message for the wider community. And Jazakumullah khair, and congratulations once again to MCB, and more importantly to every single volunteer who gave their time. Jazakumullah khair.
Thank you so much, Brother Abu Bakr. What a fantastic reflection, conclusion, and some really great insights. And thank you again for MCF's work in this area. I think some really pertinent reminders. I mean, one thing that we also said is that the volunteers themselves probably need to consider well-being at this time. And we know how much we have used the power of goodwill at this time. I just want to quickly, while we've got a couple of minutes, and just go to yourselves for maybe just a 1 or 2 minute conclusion. Dr. Justin Varney, would you like to just share any final comments from you or any key advice moving forward? Oh,
there we go. Given the power of speech again. So I suppose my reflections are, I think picking up on that final point about being compassionate through this, compassionate with each other, compassionate with people that don't share the same faith and are on a journey of learning to understand. And I think that is really important on all sides. And we've seen some great examples of this from colleagues in Birmingham. I think compassionate with ourselves about that the journey is not over, that we probably have at least another 6 months of restrictions and challenges and things we couldn't predict coming to live through, and that is really important. And for those of you of faith, and I don't share your faith, but I recognize its value, it is that however you mark your faith, it is your individual connection with your God and with your belief that is so important to your resilience during these days and times. And that is fundamental to your personal well-being. It's fundamental to the well-being of your community. And certainly I know, I speak for myself, but also for my wider colleagues in public health across the country. You know, we value the work that you do, the contributions in so many ways to communities. But we also recognize how important faith and enabling people to observe their faith is to their personal well-being and to their health. And the decisions we have to make are difficult, but they are made in recognition that this is an important part of us all being human and our lived experience during these difficult times.
Thank you so much, Dr. Justin. Really, really beautiful reminder. And thank you again for taking time out to come this evening and for continuing to support Birmingham. We're so glad that we got to share, got to have some of your wisdom today with us as well. Dr. Tanweer, any final comments from yourself?
Yeah. Just to reiterate, I think as has been said before, particularly like to thank Lincoln community and volunteers, committee, trustees for their wonderful work. But also I just want to pray from Allah. This is from Allah and we need to work together to defeat this virus. And I think only way we can do is to be careful and use all precautions and protective equipments to make sure we protect each other and work together with wider community so that people can understand. But also I want to make finally to say it is from Allah and we pray from Allah to lift this deadly virus from all of us, Muslim and non-Muslim people with no faith.
Thank you so much, Dr. Tanweer. Ameen to your duas. Just to conclude then, first of all, a huge thank you to all of our guest contributors and to you attendees as well. This report really couldn't have happened without the work behind it and of course showcased in it. So, you know, there's a tremendous amount that probably we didn't have enough pages to cover, but we hope that this will do some justice to that. And as all of our speakers have said, you know, it's not over yet. So, you know, keep the seatbelts buckled in as we continue to drive safely and socially distanced through this journey of COVID and this surreal planet that we're on right now. You know, from the MCB side, I'd also like to give a special thanks to Sakina. She is the brains behind all of this and she had the painful job of writing the report. So we do thank her for doing such a wonderful job and for all of her contributions behind the scenes. In terms of what's next, we have some events. If you do check the MCB website as part of Islamophobia Awareness Month, there will be some workshops and activities on the 18th of November and a Meet the Media event on the 24th of November. And my colleagues will share the links to that. And just a final reflection for myself, I think what we've seen is a tremendous amount of sacrifice during this time from everybody. And as some of the panelists, you know, said, patience was one thing, you know, perseverance, but also sacrifice. We've all had to give up things. And I know from all of us, whether it was Ramadan in lockdown or, some of our elderly not being able to still go to the mosques even when they opened, or just not being able to go see family and friends in the same way, job losses, to, people having to be hospitalized, loved ones have been lost. So all of us have faced some level of sacrifice, but I guess the message really here is that it's as a community and as different communities together, it's the only way that actually we'll be able to overcome this. And again, a thank you to everybody on the front line, all of our essential workers, and everybody behind the scenes too. So from all of us at the Muslim Council of Britain, again, another thank you. We hope you have a nice evening, and do share the report. We will be doing a huge kind of campaign in simplifying that message, and I'm sure my colleagues in the Public Affairs Department will manage that. So if you do have any questions, do contact us, check our website, and hopefully we'll keep you posted. And as always, keep safe, and our prayers with all of you and your loved ones. Take care, everyone. Assalamu alaikum, and thank you.